Gonorrhea is often called the silent infection because it can actually spread without showing any form of symptoms. Well, make no mistake, because the consequences of this condition could be very devastating. I mean, infertility, pelvic pain, and even death can occur. So it is important for us to break the silence about gonorrhea. Let us look at what gonorrhea truly is. Hi, beautiful people, welcome back to Isolana's Corner. If you're stopping for the first time, you're welcome. I'm your host, Isolana, and I'm a registered nurse, a midwife, as well as a professional makeup artist. And over here, we discuss all things pertaining to faith, health, nursing, and beauty. So if these are the kind of content you're looking out for, please do not hesitate to like, share, and subscribe. Join the family. And today, we're going to be tackling a very sensitive topic that affects millions of people all over the world. We're going to be looking at gonorrhea. Yes, gonorrhea is a bacterial infection that affects a lot of people. It has very devastating complications. That is why it's important for us to have an understanding of what the condition is, what are the symptoms, the signs of the condition, what are the risk factors, if there are. We're going to understand what are the treatment mechanisms that are available, as well as ways of preventing this condition, so that we can protect not just ourselves but our loved ones as well. Now, first off, what is gonorrhea? Gonorrhea is a common, emphasis is on common, it's a common sexually transmitted infection that is being caused by a bacteria called Bacterium Neisseria gonorrhoeae. Don't worry, that is not the business. Its mode of transmission is through sexual contact with infected persons. And by sexual contact, I mean contact with the vagina, with the anal region, as well as the oral region. So that is through vaginal, anal, or oral sex. You can get gonorrhea if the person is infected. And also, if you are a mother who has gonorrhea, you have the ability, the chances of you transferring it to your child during childbirth, but this is only possible if you had a vaginal birth. So as the baby is passing through the birth canal, you can transfer the gonorrhea from yourself to your child. Now let's talk symptoms. The problem with gonorrhea is that it usually is without symptoms in most individuals that are infected. That is why a person can go on to spreading this condition not knowing that he or she has the condition. But for people who have symptoms, these symptoms vary depending on whether you're a man or woman, and depending on the part of the body that has been affected. So now let's talk symptoms. I'm going to talk about the symptoms based off the different sexes as well as the types. Now, for the man, if a man has gonorrhea, one symptom the man will experience is painful urination. Like, you have this burning pain whenever you try to urinate. That is not normal, so that could indicate gonorrhea. Also, another symptoms could be discharge. Yes, a man will start having abnormal discharge. What I mean by that is that this discharge could be whitish in color, it could go on to be yellowish, and even greenish in appearance. Okay, also for a man, the man could experience pain around his testicles. There could be this form of pain around the testicles, or the testicles could look swollen as well. All these are symptoms of gonorrhea, signs and symptoms of gonorrhea. You could also have in the anal area or the anus region, that region will start itching you as a man, or you experience bleeding. Yeah, you could experience bleeding, or sometimes abnormal discharge from that region. All these could indicate signs of gonorrhea. But remember, I said that it's not everybody that experiences signs or symptoms. There are people who are symptom free, but they have the condition. Now, for the women, what are the symptoms that women experience? One symptom is there is abnormal vaginal discharge. Also, painful urination. Okay, when you're trying to urinate, you find it painful, or you experience burning pain when trying to urinate. That could be a sign of it. Another is bleeding between your period. Now, what do I mean by that? You see your period this month. Before you see your next period or have your next monthly flow, there is this interval, which is a time of rest needed for your body to, recuperate back to normal. But during that time you're experiencing bleeding, whether it is light bleeding or it's just a minor bleeding or spotting, that could indicate gonorrhea, okay? As well as symptoms like itching around the anus or discharge from the anus, abnormal discharge from the anus, as well as pain around that anal region. All this could be signs and symptoms of gonorrhea in a woman. Now, for babies, remember I said that a woman is capable of transmitting this condition or infection to her baby if she has gonorrhea. Now, for a baby, what are those signs you will notice? The baby's eyes will look reddish because the baby passed through the birth canal. Remember, this is only through vaginal birth. The baby passed through the birth canal, got the infection, so the eyes will be affected. The eyes will look reddish in color. The baby would be experiencing pain. But one thing with babies is that they cannot say or express themselves and say they are going through pain. But usually babies like that are forcing, they always cry because of the pain they're experiencing. And there's also going to be discharge from the eyes. All these are signs and symptoms, of gonorrhea. Now, what are the risk factors or predisposing factors to coming down with gonorrhea? As far as you are sexually active, you are at risk. Irrespective of your age, you are at risk of coming down with gonorrhea because you cannot 100% trust your next partner or partners, whatever the case may be. Also, for individuals who are multiple partners, you are at a greater risk of coming down with gonorrhea. For individuals who have unprotected sexual intercourse with different persons, you are at a greater risk of coming down with, gonorrhea as well. And also, if you've had history of gonorrhea before, like before now, you've had gonorrhea, it has been treated, you can still have gonorrhea again, okay? If you don't take the right steps. So those are those people or things that put you at risk of having gonorrhea. Now let's talk complications of gonorrhea. Gonorrhea, I said, is without symptoms in a lot of people. No sign, no symptoms. So now, if it is left untreated, gonorrhea can cause infertility in both the man and the woman. You find it difficult to get pregnant or get a woman pregnant. It could also cause pelvic pain and abdominal pain in both the man and the woman. Now, for the woman specifically, it could lead to tubal occlusion. What do I mean by that? When the tubes, which are the fallopian tubes, are blocked. And that invariably would lead to infertility because by the time the tubes are blocked, the egg that is supposed to be released pass through the tube to go and meet the sperm. It's not going to happen. Okay, so invariably lead to the infertility. It could also lead to ectopic pregnancy, whereby the woman is pregnant, but that pregnancy or that fertilized egg is staying in a place that's outside the region where it's supposed to stay in the womb. It could be a pregnancy that's occurring in the fallopian tube. This is outside the normal place where pregnancy is supposed to occur. So ectopic pregnancy. There are also chances of pelvic inflammatory diseases in the woman. So that's why it's important to check yourself and get treated to avoid all these complications. Now, how do we diagnose this condition? Remember that I said that one means of gonorrhea being transmitted is through sexual contact. And I specifically said oral sex, vaginal sex, anal sex, you can transmit gonorrhea through these different routes. So it's very important to note that for diagnosis, samples will be taken from an infected person or suspected infected persons from any of these regions or body parts that I've talked about and taken for culture and sensitivity to be done. Now, what are the treatments for gonorrhea? Thank God that gonorrhea has treatment since gonorrhea is a bacterial infection. The treatment modalities is obviously going to involve the use of antibiotics to treat the condition. It can actually be treated, but also ensure that you adhere to the doctor's instructions and go and get treated on time. Okay, don't procrastinate. If you are experiencing any of these symptoms, go ahead, go to the doctor. It's better to address this on time before it gets to its phase of complication, remember, and ensure that if you are sexually active, since you're already sexually active, if you're a sexually active person, if you are taking this medication, tell your partner or partners that you cannot involve yourself in any form of sexual activity, any form of sexual activity until you have completed your medication, and not just completed it until a week after you've completed your medication. That is, if you finish your medications this week, today, 7 days later, at least should be your waiting time before you involve yourself in any form of sexual activities. Okay. How do we prevent this? For me, I will always say avoid any form of sexual contact with people who are infected. It's also good that you um, ensure you use protection, specifically condoms, anytime you're involving yourself in sexual activities. Avoid all these multiple partners. If you're sleeping with A, B, C, and D, please avoid it, okay? Because the truth is, even if you're using protection, there's a limit to how you can be protected because the condom only covers certain regions of the body. It's not the whole body, it's not the whole part. And I remember I said there are several routes through which this condition, this infection can be spread. So better safe than sorry. Have one partner or avoid until you are with someone you can trust. Okay. Now that being said, we've come to the end of this video. I hope I've been able to educate you. So if you're experiencing any of the symptoms, I am team prevention is better than cure. If you've had it, go quickly to the hospital so that you can be checked and treated. It's better the doctor tells you you don't have this than for you to wait for it to get to the complicated phase. Okay. And with that, we've come to the end of this video. I hope you have been enlightened. All right. Please leave recommendations or questions in the comment section below if you have any. And until I see you next time, bye, lovelies, and God bless you.